Basically, the only changes are a 3% increase in the wages and the increase in the PER from 8.5 to 10%. We did decrease the amount scheduled for a part-time clerk because we haven't utilized the hours. We cut that in half, and we eliminated the dollars for the county attorney that we had used previously, because now we're using the county attorney instead of Ben Gates. Everything else is pretty flat.
Of these, Dr. Hatcher, these up here where you got the help, like Jenny, what's her title?
Jenny.
Nix.
Oh, she's an immunization clerk. Her
Immunization
salary
clerk.
doesn't come out of this budget. It comes out of the immunization department.
Okay. All right. Thank you.
She did not increase anything on supplies.
They're using their, I have a note in here. The
Okay.
supplies are paid from, just so you know why they didn't put a supply, their supplies are paid from their grant money, because that's an appropriation that can be expensed out of their grant. So
Okay.
they chose to keep it that way and not spend the county money on it, which I think is great.
All right.
The commissioners told us the last council meeting he's going to start doing some blood draws down there. Is that going to be a problem?
I don't think it'll be a problem. Because of some changes in the federal designations of money for the immunizations that are provided by the Vaccines for Children program, we're not able to immunize children who have insurance unless they have particular insurances that are covered under VaxCare. And so our volume of business in the immunization clinic has fallen off. So I think that April will have plenty of time to do the blood draws. I don't think that'll be an issue
You
at all.
said this is a national mandate on this blood for the immunization? Or?
The immunizations are provided by Vaccines for Children program.
Okay.
The federal government in the past has said anybody who came could receive them, and they've started cracking down on that because of the dollars involved, and say now that only totally uninsured patients or children who are on Medicaid can receive those Vaccines for Children vaccines. An exception is if a family has a plan that limits the amount that will be reimbursed for immunizations. Once they've exhausted the amount for immunizations in their family practice or pediatrician's office, and they'll sign a waiver to that effect, then they can have the Vaccines for Children vaccines.
So if she's not doing all those immunizations anymore, is she fully employed, or?
Oh, yeah. She's fully employed. She goes out to the schools. I'm just saying that she has less time in the clinic actually giving vaccines than she had previously, and so doing the blood draws is not going to be a burden for her.
Okay, good.
Dr. Etcher, the part-time inspector, food inspector,
Yes.
could that not be turned over to Scott, since the building is kind of slowed down, the well inspections, the septic inspections? Could that not be turned over to Scott and let him do that?
I don't think that he could do that without incurring a lot of overtime. Quite frankly, the 24 hours a week that, or yes, 24 hours a week that Mary Ann is supposed to be putting into the restaurant inspections could be more. We have a county ordinance that says that each restaurant is to be inspected 3 times a year. That is not happening under the 24 hours a week. She doesn't think it's necessary. The state does not require that, but
it is a county ordinance.
But it is a county ordinance. And so if there's a problem, she tries to make sure that any problem facilities are at least inspected 3 times a year or more if they need it. I really don't think he could do it with the current hours that he has, staying in a 40-hour work week, taking on all of the restaurants. He does fill in for Mary Ann when she's off sick.
I wonder if the rural from Minnesota thing, the liability for not following that.
Well, I think they ought to change it back to 2.
I do
and then
too.
If there's 3,
If
if
we
it gets
don't,
done,
we're
that's
sticking our neck out.
I I know that ordinance was looked at a while ago, I
Right,
remember that
actually, the
happening.
ordinance has been revised by Marianne and myself in a committee from the Health Board, and it's back in the hands of the board president, and then when he's finished with it, then it's going to go to the attorney, county attorney, and then when the county attorney's finished with it, it'll come back to the full board, and then it'll finally come to you.
So did you modify the inspection rotation?
Yes, that was part of that.
It's just 2 times a year.
I think we went with the state ordinance, which only requires once a year. But if you, I mean, it's your prerogative to make the local ordinance more stringent than the state ordinance if you want to.
I just think of whatever we do, we should do it. Whatever that ordinance says, we should comply with it.
Any other question for Dr. Eddy? Thank you for your time.
Sure thing,
Thank you, Doctor.